So in this section, we're going to be talking about hopefully providing you with a better understanding of what misuse of a consumer document restriction looks like, know when not to view a My Health record as a clinician, and understand those penalties as mentioned previously. So before we get into misuse of the system, firstly, let's understand what the rules are around using it appropriately. So in relation to viewing someone's My Health record, in most cases, as a healthcare provider, organisation or a clinician, you're, of course, allowed to access your patient or your resident's My Health record to provide healthcare services. In an aged care setting, this would usually happen as you need to seek information about your residents within your aged care facility or your home. They may be physically in your presence when you do this. However, there are other times when access may be authorised to look at the record. This may be when your resident is not physically present. So, for example, you may access into their My Health record to check their discharge summary to determine any changes in their health condition based on previous test results post-hospital admission. You may access the record to refer to their shared health summary to help formulate a care management plan based on their health history. You may also look at their My Health record to see if they are taking any medications, such as blood thinners, that may need to be stopped before potential surgery or procedure. And you may also check their My Health record to determine their test results and health history for the purpose of an intended hospital transfer. Within aged care, you currently do not have any documents that you can upload. However, the launch of the aged care transfer summary is imminent. You may remember that I made reference to it in one of the earlier slides. So this will be software dependent, and it's not unlike the yellow envelope that we use when we're transferring residents to hospital. Quite often we'll put in a wealth of information all about the dietary needs, their mobility, the rationale for actually sending them to hospital in the first place. So it's like a whole snapshot of care documents that we usually send with them. You may be familiar with that. So this is kind of like a digital version of that. And I'll be talking about that in another topic as well. So misuse of the system also applies to inappropriate uploading of health information. So all clinicians in all settings must comply with the wishes of the patient. So if they state, please do not upload that information, the clinician must abide. You may or may not have noticed yourself, if you go to pathology and get some bloods done, there is on the pathology request form a little box that says, do not upload to My Health record. So if you do not tick that box, or if you do not request it to be ticked, the information will go up to My Health record. So at every point, the information can be blocked by the consumer. So let's identify some examples of misusing the system. So if you access My Health record and you are not the designated aged care provider, meaning the health organisation that you are a patient at, you cannot access anyone's information. You are not permitted to access the information unless they are particularly a patient of yours. If you're not the nominated clinician specifically working for the provider, you're not allowed to access the record. If you're not the designated clinician providing direct patient care, and if you're fortunately accessing a record for a resident that is not in your care, say, for example, if you're admitting someone and there might be a sports star or a movie star, some kind of a celebrity, but you're working within the organisation and you're quite curious about them, if you enter into My Health record, there are penalties for that. It could be a family member that's coming into care, and you may want to have a little look-see to see what is happening within their My Health record. That is not a legitimate use of using it, and that is considered to be misusing the system. If you are utilising the emergency access function for inadequate reasons, and we'll be expanding on that a little bit later on, or if you are curious about maybe what documents have been restricted in someone's record, these are all examples and breaches, and there are penalties, of course, that apply for anyone that breaches the system unlawfully. So what are the penalties for misusing the system? Up to 5 years imprisonment, individual fines for the clinician up to $315,000, and for your organisation, $1.665 million. So they're quite strict, and you might say, well, how will they even know that they're not my patient? How we would know is because when you register for My Health Record, you've got the HIPPO that tells us, so in the back end of the system, we know which organisation has been accessed, we know which clinician within the organisation has accessed it, and we know which patient through those 3 pieces of encrypted data that we talked about before, the HIPPO, the HIPI, and the IHI.